We do not want to see you in a nursing home even for a single day. So that is our goal.
What exactly is an adult daycare center?
So adult medical daycare center is an intermediate stage between home and an institution. When I say institution, it means an assisted living or a nursing home or a rehab center.
So it's like a fun place for an adult and also a helpful place where they can be taken care of.
It's always a party going on. So you have a reason to get up in the morning and get out. When people mostly don't have a reason to get up, the life goes down from there because then you get lazy, you don't get up. You say, what's the point? Even if I get up, I don't have to go anywhere. So it affects you psychologically very much. So adult medical daycare helps these kind of participants.
Hello everyone, welcome to Ambitalk, presented by Ambigramy. I'm your host Parth, and today we are talking about something that many families face but don't really understand: adult daycare. Whether you have an aging parent, a loved one with special needs, or you are just exploring how to take care of an older adult, then this episode is for you. With us, we have Mr. Amrish Bhimani, owner of an adult daycare center here in New Jersey. Today, we are going to talk about how an adult daycare works, who it's for, and how it can be a life changing support for both families and their loved ones. Before we start, hit like, share, subscribe, and follow Ambigramy. Let's begin. Welcome, Amrish. Let's start with your story. So tell us what led you to open an adult daycare center and who is it actually designed for?
Thank you very much. First of all, thank you very much for inviting me in your podcast. Very happy to be here.
It's our pleasure.
Thank you. And the reason why I am in an adult medical daycare business is I had a family member. One of my uncle used to go in one of the adult medical daycare center close to his home. This is about 20 years ago, and it changed his life. He was so happy when he comes home. Lot of his diseases or the problems that he was having psychologically or physically improved a lot, and which led me to thinking that it could be a good program. So I was looking to open some a business, and I thought, why not try adult medical daycare? So I started researching a little bit, and I started reaching out to the existing adult daycares to learn more about the program, and that's how I get into this business.
So it's like something personal. You are very much connected to it.
Yes, it is very, very personal. For a medical daycare center, is you have to have a heart for this kind of line of program, because if you don't have a heart, it's not going to work for you. And I truly feel blessed and happy to be the part of this program.
So for our audience, let's explain them what exactly is an adult daycare center.
So, adult medical daycare center is an intermediate stage between home and an institution. When I say institution, it means an assisted living or a nursing home or a rehab center. So, adult medical daycare, it provides a primary medical needs that you do not need 24 hours care, but you need medication administration, you need insulin administration, you need to check your vitals. You want to make sure, you want to make sure that your family member, your parents, or whoever is attending the program does not need a supervision full 24 hours, or they just need the care for when you are not at home. So that is the adult medical daycare program. So it's a good program. It's a lot of fun, and it's a very, very happy place to be.
So as you own a adult daycare center, let's know that how does your center make something unique for adults?
It's a good question. In a way, every center is unique. The reason is I wouldn't say that my center is the best center because it's person centered care. So I give you an example that let's say if you're looking for a center and my center is far away, but you are looking for a shorter transportation time, then you obviously the center that works for you is closer to your home. So and to be the medical adult medical daycare program in New Jersey is highly regulated by the Department of Health, and it has the regulations. So every center follows that regulation. So in a way, every center follows the same process. But what makes it unique is one, if it's closer to your home. Two, if you have a friend or family member, a person you know is attending a particular adult daycare center, then that center is for you, because it's easier for your family members or participant to
It's like
looking
gel up
forward.
with each other,
Yes,
and
yes.
yeah,
So they see a familiar face, then they connected, they got to see them, can talk to them, and it feels like home for them. So every center is unique based on a participant's
needs.
perspective
Yeah,
needs.
yeah, perfect. So, like, what kind of services and support do you offer for a participant in whole day?
So in New Jersey, the adult medical daycare program is for 5 hours. It includes the transportation too, but that is not included in the 5 hours. So every participant's been pick up and drop off by the adult medical daycare center. So it's a 5 hour program, as I said. So let's say I'll give you an example how our day look like in an adult medical daycare program. So, every participants were given a time that we will pick you up 8 in the morning, 8:15. Based on the time, our vehicle will pick up a participant from your own home. They will come to the center, and mostly most adult medical daycare centers, particularly all my centers and other providers, the day is you come in, and if you have blood pressure, blood sugar check, you go to the nursing. They will check your blood pressure, blood sugar based on your doctor's order. Then you will have a breakfast, then there will be an exercise. So it's a scheduled activity for all 5 hours, and the activity calendar is posted in all the facilities, all adult medical daycare in New Jersey. So like once you have a breakfast, you do exercise. That's a group activity. Then based on your interest, they will you will let's say one group is playing card, one group is playing some other table game, one group is doing arts and craft. So you will do that, and then you will have a lunch around 12:30, and you go home at 2. So if you come to the center at 9, you will go home at 2 o'clock and be dropped off at home, depend on where you live. In between, our nursing staff will make sure that you took your medication. If you need an insulin administration, or let's say if you need a medical screening, it's time for you, it's a flu season, so you need a flu shots. Your pneumonia vaccination is expired, so we'll make an appointment for that. And if you need another any other doctor's appointment, let's say our nurses say that, okay, last appointment you have with your primary care was like 3 months ago, so it's time for you to make an appointment. So we will make an appointment, we'll take you to the appointment. So this gives so family does not have to take a day off. It releases a lot of burden from the family's responsibility. Plus it's centered care, so person centered care. So what happens is we know everything about every participant,
Perfect.
and that makes this program more beneficial for taking care of this participant.
So it's like a fun place for an adult, and also a helpful place where they can be taken care of.
Yeah, it's a very very fun, a lot of fun there. It's a very very good place. All adult medical daycare program are very good. They're doing the great job. And it's so there is I'll give you an example. If you have an activity calendar, so today is a particular festival, 4th of July, you have a Thanksgiving Day, you have other ethnic festivals, then everything is celebrated, all depend on ethnicity or the culture of the center. So it's always a party going on. So you will have, because, and the other thing what matters the most in my opinion is you have a reason to get up in the morning and get out. When people mostly don't have a reason to get up, it's uh, you know um, the life goes down from there, because then you get lazy, you don't get up, you say, what's the point? Even if I get up, I don't have to go anywhere. So it affects you psychologically very much. So adult medical daycare helps these kind of participants um, with independence and dignity and choices they make for their care.
Our audience would like to know that. Do you offer like some programs like therapeutic or recreational programs?
So it is a scheduled activity. That's by the regulation. You have to have a schedule for all the activities, and there are recreational and therapeutic activities there in any adult medical daycare, all adult medical daycare.
So what does these activities look like?
So activities depends on your cognitive level and on your activity assessment. So let's say if you require a mobility, then there will activity where they will do an exercise, or an occupational therapy will be provided, or will take you to physical therapy, occupational therapy. So you get a little bit better on your locomotion, mobility, and all. Cognitive activities are there. A lot of board games, arts and craft, and we evaluate each participant every 90 days. So based on your participants, the activity director makes notes and see whether you're improving or not improving, or we need to change the care plan.
So, like, do you provide medical care, meals, or transportation?
Yes, this is an all-inclusive program in New Jersey. So transportation is included, medical care. So every medical daycare center, each medical daycare center has administrator. It has a social worker. It has a nursing. It has activity department and dietary and a pharmacy consultant. So it is the same as a hospital, but not in that extensive level. So all this department works and coordinates everything, the person-centered care. And and they evaluate everything, all the disciplines every 90 days, make changes in the care plan, so we will be able to take care of your loved ones in a better way and in an improving a way of life.
So there will be like many types of patients. So how do you cater to adults, those with dementia or mobility challenges or with some specific needs?
So each staff, all the five discipline what I mentioned here, the nursing, administration, activities, social worker, they're all licensed professionals. And we get a feedback from other care partners like physical therapy, occupational therapy, and medical professionals, primary cares. So and our field staff, our program aides, they are all trained. There each staff goes in an extensive schedule of in services. So they all have the in services and training that is needed to take care of a particular participant with dementia or Alzheimer's, or if somebody is in a wheelchair. So our nurses, they know how to take care of them, taking them to the bathroom, a restroom, and providing a care that they need. So it's all documented. They're all well trained, and this is required by the state of New Jersey Department of Health.
So, like, what does the most important benefit an adult gets at an adult day center?
In my opinion, it increases all your lifestyle tremendously. It's an overall improvement over all the aspects of your life. When I say that, I mean, as I said earlier, if you don't have a reason to get up in the morning, you don't get up, and your health goes downwards from there. So I see some, I'll give you an example on a particular participants that, if they're staying home, um, they don't have a schedule. So they take your own time. They're getting slow, getting out of the bed. They're lagging behind in a day. And, most seniors, most people at the age group, they will Just get up, take a shower probably, and sit on a sofa, watch a TV. When you don't have a reason to get up, you don't get up, and then your health, you get a slow start in a day, and it affects your cognitive level. So most people, if you can notice it in your family, my parents, my grandparents, if they get up in the morning, they have a slow start. Once they're done with everything else, they sit down, probably watch a TV mostly, right, in the current conditions. And when a person watches a TV, they not tend to drink that much water. They don't get up that much. And that affects physically as well as mentally. It is your mind is occupied with something that is not going to help you. And you, without you realizing that a smaller thing, drinking a water or go to the restroom, or get up every half an hour or so, your body and mind will go downwards. In a way, in a matter of months, you will see a significant change in a person's well-being. The adult medical daycare program, a person is ready. I had a participant with the same issues, withdrawn from the day-to-day activities, or conversation even with the family member, physically, cognitively go not doing well, and the family reached out to us, and she started a program. In a matter of weeks, when we called them and asked for a feedback, they say, my mother is now ready. She's looking forward to go to the center. So she tells us, okay, I have to get ready because my bus is going to come at 8:15. And she's overall, it changed the entire lifestyle, entire behavior. And she was healthier. Was on a lot of medications, or cognitively not that well. And she participated in a conversation in the family because she's so happy to talk to the family about the benefit, what they did at the center, what was the day today. And she was sleeping well. So these are the benefits which you don't get with any medicine.
These were the benefits of participant. I would like to know what benefits do families get, how it's their life transforms.
So, it is the same benefit for the family. If you have an elderly, frail person to take care of yourself at home, it is, it's not easy. It is not easy. I would say that if a person attends to a medical daycare facility, the family can get a recharge time. They don't have to worry about cooking meals for the family member. They don't have to worry how I'm gonna take them to a medical appointment, because most people are working, and it is hard for them to take time for their loved ones. And so all those things are taken care of at the center. Your medical appointments, your meals, your nutritious, intake, everything is there, and that takes a lot of burden off the family. That's on a medical side. And even some family members don't even know how to take care of their loved ones with, let's say, if you have somebody with Alzheimer's, it's very hard for family to learn how to take care of their loved ones. If they receive a government paper, a mail for a recertification, or something to do with their food stamp or their insurances, it is a lot of work, and we can take care of it. All adult medical daycare centers, they have social workers, they have qualified staff that will take care of all those things and take the burden off of the family. And what it does is, you are not burned out taking care of your loved ones, and
Yeah. So
that
it's
is the
like
biggest benefit.
everything is taken care of. Like, as a family, your loved one is happy. As a family person, you are happy.
Yes, overall, everybody is happy in the family, and it improves uh, the dynamics of a family. And so a mother or a father would not say, "Okay, my children are not available; they're always busy. How
Yeah.
am I going to get there?" because now they know that the daycare, they once they go to the daycare, all their needs are taken care of.
Yeah.
They don't even have to talk to their children about it.
Let's talk something about the serious issue that an adult faces, like the social connection, and how does your center support the mental health of a adult?
No, but, it is a good program. It's a happy place. All our staffs are very much involved with all the participants. So, we know if we serve them a meal, we know which person likes, whether likes these broccoli, or who likes the, other ingredients that they like or don't dislike. So we are taking care of them, and we'll try to make them happy. And the most important thing is the social interaction. So I mean, a person can argue that I am qualified to take care of my family member. I do not want them to send them to a daycare because I don't know. So it is a proven that one-to-one interaction is not enough. If you are at home, you may be taking the best care of your loved ones, but it's only one-to-one interactions, and when you are free, it is not always the case. So when they go to a daycare, it is a fun place. There's many more people that you they can interact with. It's not one to one; it's one to many, and they will find a companion or a friend where they sit down and they say, "Okay, I like to play cards with this person. Where then I like to eat my meal with this person."
Yeah.
And you have a lot of choices. So I mean, it's a win-win situation for everyone.
So it's like fun activity for adults, and now we know that families also can be benefited with this. So how can a family know that it's time for an adult daycare center for a loved one?
A very good questions, because over the 15 years of experience in this field, um, I realized that when most people are, come to the program at the very end when it's getting out of control. Our focus, the adult medical daycare program's focus, is on healthy, dignified life. The quality of life is the pure focus of the program. So if you come late, you missed out on a lot of good years that was in the life of your loved ones. So it is always a good time. You don't have to wait until it is getting out of your hand, or you feel that, okay, now my family member, I cannot leave him or her alone at home. No, that is already too late. So statistically speaking, people who attend a adult medical daycare program started earlier. They reduce the institutionalization, which means a nursing home stay, or very significantly, almost half. So I mean, everybody, when you say, your loved one, your family member, has nothing better to do at home, and has even doesn't have any illnesses. It just socially they are isolated. It's the time for you to go. Even though person is independent, they does not need that level of care, but you start looking, you start visiting the centers closer to your home, and know more about the program, because the sooner you start, the better the quality of life of your loved one will be. Don't wait until it's too late. Most people wait until it's and they missed out on a lot of good years, and a good quality of life on their family members.
Can you share with an example for this kind of situation?
So, like if I have two participants, one started at the age of 65, and one started at 75. The 65, she has just a minor insulin administration, nothing major, skilled nursing needs, and a few, supervision, ADLs mean activity of daily living. And a person who start at the later age, with some cognitive functions impairment, forgetfulness and all. So if you think between the two, um, you know between those years, that if this person with the cognitive deficit would have started earlier and had this social interactions and a medical oversight, primary nursing care, it wouldn't be there. So I see a lot in our daycares that persons reach out and they say, okay, my mom doesn't remember anything. Can you take them? We will take them. That's our goal for this program. But it is already too late. So sooner you start, the better the quality of life would be for your loved ones.
Yeah. So it's like you shouldn't wait for some situations to get
Yes,
worse.
you should not wait for a trigger that, okay, now I think I'm gonna take care of them. As I said earlier, you can take care of them the best possible way, but social interaction is the key for mental health. If
Yeah.
you are not actively communicating, participating with a bigger group, your health is not going to be the same in the later years.
So as we say, a human is a social animal.
Yes, exactly. And it needs a social, everybody needs a socialization.
Yeah. So what's the process for joining an adult daycare center? Is there an assessment or an eligibility criteria?
Yes, so adult medical daycare program in New Jersey, it's covered by three programs. One, I would say mostly it's funded by Medicaid. So if your loved one has Medicaid, which is provided in the state of New Jersey with the five insurance companies. So if you have that NJ Family Care or Medicaid, you automatically and you qualify for the eligibility criteria, which is a primary medical needs, a cognitive deficit. You are entitled to enroll in this program. The second is you can always pay privately to enroll in a program. So if you are not qualified for Medicaid, you have financial ability to pay for it, you could also enroll in the program. And there are certain programs with the county that you reside in. County options are you can reach out to the Department of Aging, and if you don't have Medicaid and don't have financial capability, they will help you to get into the program that they're contracted with. And that is for the cost. Um, the normal process is for an admission. So let's say you qualify for you have one of these payer source, then each person needs to, before enrolling to the program, each facility will has history and physical form. So let's say if you're planning to attend to my daycare, we'll schedule a visit for you. You can come with your family, spend a few hours, talk to other participants or staff members to know more about it. And then if you decide to come to the program, we'll give you a history and physical form. That form needs to be filled out by your primary care physicians. The primary care physician will give us an order to the facility what needs to be done for you. So once we receive the history and physical form, we'll send a prior authorization request for the Medicaid participants to their insurance company respectively. They will come and do an assessment and whether approved or deny the admission to the medical daycare. Once you're admitted, all the disciplines, the social worker, they will do their assessment, your psychosocial needs, your payer source, your certification, your food stamp, SSI, all those things. The nurses will do a comprehensive nursing assessment based on your history and physical from your primary care. Then they will develop a care plan for different diagnoses or different level of care. It will then go to a dietitian, which will do her assessment and see the meal or nutritional needs for you. And then we'll go to an activity director, will do your activity assessment. And all of this discipline every 90 days will sit down and try to make see whether the goals are met or define new goals. So it is like a nursing home but not a full time. It's an extensive work. And so this is the normal way of admission and post admission process for adult medical daycare center.
So how do you ensure the safety, dignity, and well-being of a participant?
All our staff are trained and in service regularly. They are licensed. First of all, the license have ethics standards. The staff who are not licensed are trained by a professional, license holder like our nurses. They will give them an in-service or training on cultural background, on a tolerance, on abuse, participant rights. So everybody, even the participants, when they get an admission, they will get a copy of the participant rights, which states everything. And if, let's say, if I have a participant who doesn't speak English, then we'll give them in the language that they speak so they can read and they know their rights very well. But the staffs are all continuously in service, trained, and supervised for providing quality services to our participants.
So from this, like the staff is trained, but how exactly do you prefer to train your staff?
So there are multiple various ways for training. There are some online trainings. There are some supervisory. So the nurse will supervise what they learn online classes. They have a test, and there are reading materials. There are experienced people will tag along and see if the level of care and the dignity and all those parameters are met when this person provides services to your loved ones.
Okay. How do you keep families involved and informed about what is going on with their loved one?
So the families are, we have a comprehensive system that we reach out to the family. So let's say if we notice something wrong with your family members or our participant, let's say if has a problem walking properly, or we see a bruise on their hands, or or anything visually when we see, because see, they come there every day, 5 days a week. The program runs 5 days a week. I mean, some centers are open 7 days a week, some centers are open 6 days, but you can only attend up to 5 days a week. So most centers have staff that take care of our participants, so they develop a bond. So if I'm taking care of my participants and I see some unusual, if let's say they seem different today, or they seem in a pain, or they not walking properly, the first thing, our first protocol is the person notifies the nurses. They will do an assessment, then will reach out to the family. It doesn't have to be medical or nursing needs, anything at all. When we see a behavior change, pattern change, it will go to the nursing, and we'll find out more what happened, and we'll reach out to the family. Many time, our nurses in a little medical daycare, they have prevented heart attacks. They have prevented or diagnosed cancer very earlier, just based on the observation and knowing more about these participants. So the other way, it's other ways we interact with the families. It's, let's say, if somebody's birthday is coming up, and the family reach out to us and say, okay, I want to surprise my mom, or I want to surprise my dad, can we do something in the facility? So we provide that platform. They can come anytime they want to give a surprise birthday gift or a present to their family members. They're always welcome. Every visit is scheduled. So if a driver goes there and somebody doesn't come out, then our protocol, normally all adult medical daycares, they will make sure they push the doorbell, find out what is happening, and if they're not getting in touch with somebody, we'll reach out to the family. In our charts, we have emergency contacts. So anything unusual or anything good is happening, the families are notified that something wrong or something good has happened today.
So from this, we get to know that the family is well informed for the participants.
Yes, exactly. They, nowadays we have a social media, so WhatsApp group, the family, we communicate via a WhatsApp group to family members, or the facilities, programs, pictures, and announcement goes there, so they know exactly what is happening in the center.
So I would also like to know that what advice would you like to give a caregiver who has faced a participant who feels overwhelmed or guilty of taking outside care?
No, I see there is nothing wrong reaching out. You cannot do everything by yourself. That is the rule number one, especially with elderly population. You have a family member who really needs a lot of care. Why not go to the professional? It's nothing wrong. Your family member will feel better is in a professional standards of care. It will be taken care as it's a personal person centered care. So it's not like a cookie cutter one system for everybody. Every participant has different needs, and our staff are tailored to provide those needs. So I think the key here is start early. When you see the first thing, when you see something unusual, when you feel that you want to see your loved ones happy and live a dignified life, quality life for a long time, start early. Don't do it alone. We are part of your family and we are here for you. So, and this is what we do. Changing lives is and making a difference is our philosophy.
Yeah. So that's nice to learn about this. But I would also like to know some of your personal experiences of a participant, like your worst experience and your best experience. We'll start with the worst.
Yes.
So,
No, I mean, see, there are people with their, psychosocial level of brain or cognitive deficit, and there are people who, because of their background, they're very s- difficult to be taken care of. And I give you an example. I had a client who was moved from the family told me that he's been to 3 4 other daycares. He's a very difficult person. I am not sure how long he's gonna be with you. Please, can you take him? We said yes. So our philosophy, our daycares, all my daycares are, we take care of the difficult people the most, because good persons have many other people to help them. It is the difficult person has the hardest time to get along with anybody. So it's not easy. It will take some time. It will take a lot of time. In our case, it will take us about over a year and a half. And the son called me and say, what did you do to my father? He's completely changed. There are no episodes of outburst or anger or anything. And that makes us happy. That is difficult part. I wouldn't say the worst part, but it was a difficult part. And there are many other instances where we just by observation and checking with the patients, talking to them more, knowing more about them, encouraged us to find a diagnosis which was in other cases would not have been known. And that improves the quality of life for that person by providing the right care. So it is those are the good example. I mean, I don't have people mostly I wouldn't say the worst example. It's just a behavioral example that a lot of people, it takes us a long time to make them understand um, the the value and of a quality life. Sometimes they don't take their medications. They are depressed. They don't want to improve anything. They don't participate in activities. They're
yeah.
withdrawn. So I wish that people would see the value in living a quality life. And behavioral here and there, like in a family.
Yeah.
And there's not always everybody is happy. If you or 4 or 5 people, everybody has their own mind. Same in a daycare, it's a family of a 50, 100, 120
Yeah.
people. It's
So
not
there will
easy.
be like different ethnicity, right? So
Yes.
how do you even manage to take care of cultural differences that they have?
It is very interesting. I give you an example. I have two ladies, totally from different ethnicity.
Okay.
They don't even speak each other's language,
Okay.
but they sit together. They do all the activities. They even talk without understanding each other,
Wow.
and they've been best friends. They go everywhere together, you
Wow.
know,
Wow.
and take care of each other. So I don't think at this age, if you really have
The
a mind
understanding.
to live a quality life. It is there. It just you have to make an effort to get there. And I would say the people should be more accommodative and would should have more open mind to other culture. Every culture is unique, different in their values, their philosophy, their religion, and we respect everybody. So it makes us happy that uh, people culturally go along very well. I mean, it's not that hard. We think that if a participant speaks a different language and say, your center has only this language, it may not help my
Yeah.
um, parents or my family member. I would suggest try it out. You'll be
Yeah.
surprised to see that people at this age, they are very very good in communicating, when provided the right environment.
Perfect. So, as your adult daycare center seems very legit and seems very good to be a place where one should apply. So, are you accepting any new participants, and how can one family can schedule a visit to your place?
Yes, my I have three centers in New Jersey. It's one in Old Bridge. It's called Always at Home.
Okay.
One in Sayreville, South Amboy. It's called Just Like Home. And one in Parsippany. It's called Parsippany Adult Daycare Center. And all the other centers in New Jersey. Most people, the way you reach out, you for our centers, you can call me. My name is Amrish again, and my phone number is 732-991-3782. Again, my number is 732-991-3782. And schedule a visit with us in any of our facility, and we will gladly give you a tour. You could stay there, see what is happening, and assess the benefit of the medical daycare program by yourself. You could also go to centers that are closer to you. You could reach out to them by going to Google and look for a long-term care facility in New Jersey. There are a lot of advertisement everywhere. But I suggest that you don't go to the facility that I suggest that you visit, a
Multiple
few
places.
multiple facilities and see what works for you. I could have the best facility in my opinion, but that may not work for you.
Yeah.
So try it out and see which facility fits you.
Perfect.
Adult medical daycare program is a very good program. I would put my family member there if they qualify. Not because I operate I operate this program, but there have been research has been done, and this program is available all over the country, and it is a part of a home and community-based services. I'll give you an example. Whenever as an administrator or as a license holder, when I go to a seminars or a continuous education in a five-star different nursing home or assisted living facilities, I always talk to the people there, the members there, if they're sitting outside, and I ask them this question that, you have a very, very like a seven-star, beautiful
Facility.
building and a facility, nice meals. Do you like it here? 90% of the people say, no, I want to stay in my own home.
Wow.
So this adult medical daycare program provides you this platform of having an independent life, living in your own home, sit on your own couch, and still be benefited with the program. Anybody has any questions about anything at all, you do not have to call me just to get an admission. But if you really need more information, you have any questions or concern, I would be happy to answer that. And all medical daycare, they have a social worker. Anything regarding your insurances or benefit that you want to get, reach out to the centers near to your home, and they will gladly help you with that.
What a thoughtful and important conversation with Mr. Amrish Bhimani. Thank you for letting us understand how an adult daycare can transform lives of families and their loved ones.
Yes, I agree with you 100%. This is the best kept secret in a home and community based services. I would rather, I Encourage everyone, even if you are not there, find out more and learn in advance how this program will benefit your family member in your life. Adult medical daycare program, the philosophy is to make you live a quality, happy, good, disease free life as long as possible. We do not want to see you in a nursing home even for a single day. So that is our goal. And you, by knowing more, you can avoid this by taking an action and find out more about the adult medical daycare program in New Jersey or any other states where you live in.
Thank you so much for being with us.
And my pleasure. And I'm very happy to be here and grateful that I had this chance. I have this chance to be part of making a difference in people's lives, and I'm very happy and grateful for that. And to be with you today, and with this medium of this podcast, to reach out to many other people who really can benefit from this podcast. So thank you for having me.
Thank you for listening to Ambitalk, presented by Ambigramy. Be sure to like, share, subscribe, and hit the bell notification for more stories that matter. See you in the next episode.